So we're in surgery and this is Millie. She's actually got a bad tooth, and when you look at it, it should be nice and smooth and polished, and she's actually got this loose fragment here, and to be honest she's actually had, I think that's broken off in the past as well, because that pulpy bit there shouldn't be exposed. So I think she's she could have done it all at the same time, but I wonder if she's actually done it in 2 separate occasions. So this whole tooth, the slab and this tooth, need to be removed. You can see how swollen it is up on the gum in red, and the owner was saying how bad a breath she's got, not to mention the amount of pain that the dog would be in. So this is quite a common injury I do see. I often pick it up on vaccinations and just general checks, but certainly I'm trying to teach people to actually look at their own dog's mouths and just detect it sooner, because this has probably been festering away for a wee while now. So we're going to get on and remove this tooth, and hopefully she'll be a lot happier once it's out. Thanks. So I've just taken this tooth out of Millie, and it's quite a big job because it's a 3-rooted tooth. So there's the 3 holes, 1, 2, 3, and I've actually just drilled and filed it down so it's nice and smooth, and we are going to put some stitches in that just to make it close over a wee bit quicker. I was just going to show you the tooth. So we drill it into 3 bits, and then we get each root and there's a wee root as well, so 3 roots, and then that's our little sliver that was causing the whole problem in the first place. So often this is due to crunching on really hard things like bones, so the dental sort of specialists say that it's better to chew on like dentist sticks or pig's ears or something a wee bit soft that's going to give, rather than bones. So I'm a bit of a fan of not feeding bones, just because this is the damage they can cause. And so that tooth's not going to regrow. She's lost that tooth forever now, but she'll do alright. Everyone seems to think animals need all their teeth, but I've seen cats and dogs with hardly any teeth and they can still eat and live, and at least they're happy without having a smelly, yucky, painful breath and mouth. So that's Millie, so she'll heal up pretty quickly now and be a lot happier. Thanks. So today we have Millie. She came in a little while ago that was drinking a lot and just not really happy. So we had a wee look over and did a few tests, but the main thing we found is that she actually did have a sore tooth, and it was cracked long ways, and it was so hard to actually see we nearly didn't even see it. So she's had that removed the other day, and we're just now looking to see how it's healed up. And it's where the tooth was, and it's healed up really nicely. And her owner's just reported today that she's just such a different dog, so much happier. The drinking is less, so yeah, just a lot happier. So she's going to have a vaccination today. I've checked her out, she's all pretty good. We did take a little wash off her leg while she was under having the tooth done as well. So we've taken the stitches out on that, so she's all good. So we're just going to give her vaccinations. So one's for parvo, so that's going to last 3 years. Good girl, Mel. And the other one, of course, is for kennel cough, so she can go to boarding kennels. And you can get 2 types. There's an up the nose one for that, or an injectable. Millie doesn't quite like things being stuck up her nose, so she gets the injectable one. And that's her done. So she's good to go now, and she's a lot happier, aren't you, for having that tooth out. So that's Millie.